Good afternoon, folks. I've got discussion A for you. Give me a minute to set up for the show, and I'll be right with you. Okay? Okay. All right. The title for tonight's A is Dying Specialties, which medical fields are at risk of disappearing. Frames a question about medical specialties that face declining demand, structural change, or potential absorbance rather than literal extinction. It signals an exploration of which fields might shrink dramatically, be absorbed by other professions, or be transformed by technology and market forces. Main drivers named on the surrounding page: artificial intelligence and automation, computational tools that can perform tasks previously done by specialists are reshaping roles and workflows. Health careers, workforce shifts, and advanced practice providers. APPs, nurses, practitioners, and physician assistants are increasingly taking on duties that once required physicians, changing staffing needs. Market saturation and oversupply. Too many trained specialists relative to demand can make some fields less sustainable and less competitive for residency applicants. What disappearing usually means in this context: demand shift rather than total elimination. Many specialties are likely to change in scope, have fewer full-time physicians, or see routine tasks delegated to other clinicians. Or AI not vanish overnight. E-health careers. Role redefinition. Specialists may focus on more complex cases, oversight quality control, or procedure development, while routine interpretation or care is automated or delegated. Likely short and medium term consequences for clinicians and trainees. Less competitive residencies and more un- unfilled positions in affected specialties as applicants respond to perceived instabilities or instability. Pressure to upskill or subspecialize. So clinicians can offer expertise that is hard to automate or delegate. Practice consolidation and changing job markets with hospitals and clinics uh, restructuring roles and hiring mixes of physicians and APPs. Practical takeaways for someone in or entering medicine. Anticipate change and build transferable skills. Diagnostic reasoning, complex procedure expertise, leadership, and interdisciplinary collaboration remain valuable. Monitor technology and workforce trends in your field and find and consider subspecialties, training, or hybrid roles that combine clinical, supervisory, or informatics responsibilities. Treat the headlines as a prompt to adapt rather than a prediction of disappearance. Many specialties will evolve. Clinicians who adapt to new roles and supervise all APP workflows will stay relevant. Okay, guys, so that is A for you. I will be back on shortly with B. Give me a little bit for B, please, and I'll be back on with that for you. For now, Gator Wellness, take care, folks.